welcome to the Social Justice Research Seminar series. This is a little bit of a different session. We are going to be having a panel discussion today as opposed to just a research presentation. And I'll give a little bit of history just to kind of bring a little bit of context. So, I mean, obviously, every election carries with it consequences, and regardless of the outcome, there's oftentimes a lot of relevance to those election outcomes for particular populations. And today we wanted to have a dialogue about what seems like potentially a very dramatic change in consequences as we move from a Biden to a Trump administration, and what that may pose for social work over the next few years. And um, to provide a little bit of context, there was a number of faculty, including Mike Hurlbert, Ruth Sopranovich, and Anne-Marie Yamada, who were instrumental in asking if this session and a dialogue about the future of social work in the next few years could be held as part of this research seminar. And I agreed to host such a session. And so welcome to all of those of you who have chosen to attend this. I hope that it will be a fruitful discussion for you. I just want to say that we are not envisioning this as a platform for expressing grievances about the election or debating the rightness or wrongness of the vote. This is really meant more to be a dialogue about the future and how these changes may impact our profession. And so toward that end, if you would like to ask the panel questions, please use the question and answer, the Q&A feature, and we can address questions. The format for this is going to be, first, briefly, the four of us will go around and do some brief introductions for ourselves, for those of you who may not know what our particular backgrounds are. And then I will ask a series of questions to each of the panelists, really trying to focus in on what their areas of expertise are. And then we will take questions from the panelists to one another, questions from the audience, and that'll take us up to the probably 1 o'clock without probably it'll fly is my guess. I think there's much to be discussed. So with that in mind, I'll briefly just do an introduction for myself, and then I'll turn it over to maybe we'll just sort of call on the next person to introduce themselves as we go around the room. So I'm Eric Rice. I'm a professor here in the School of Social Work. I'm also the Associate Dean for Research at the School of Social Work. And my research and advocacy efforts in the last several years, or really 20 years, have been primarily focused on young people experiencing homelessness in Los Angeles and around the country. And I've done a lot of work with both racial and ethnic minority young people, especially Black and Latinx young people, and also a lot with lesbian, bisexual, transgender, queer, gay, bisexual, LGBTQ communities, so non-cisgender and sexual minority folks who are a part of those populations. And I have been really interested in issues of appropriate housing interventions and appropriate health and mental health interventions for those populations over the last while. And I also do direct a center for the USC Center for AI and Society, which has a mission of doing just and responsible artificial intelligence driven research on major social problems such as homelessness and health and well-being and climate justice issues. So that's me. And I guess I will go alphabetically. So Robert, would you like to introduce yourself next?
Thank you, Dr. Rice. Honored to be here with my fellow esteemed colleagues. Robert Hernandez, been at USC School of Social Work for almost 17 years. A lot of my work focuses on community trauma, its impact on healthy development, specifically youth development. A lot of my efforts look to redesign what we call public safety, make it more community-centered with non-traditional practices like people with lived experience, people who have what we call license to operate, the ability to disrupt, intervene, and redirect violence so we could have access to care for some communities that are immersed with community violence. I currently chair Congressional District 29's Juvenile Justice Advisory Council, and we look to really lift up the youth voices and do true justice by some of our most marginalized and forgotten youth. So it's glad to be here, great to be here, and thank you again for having me, Dr. Rice.
Fabulous. Going down alphabetical order again, then Jane, would you like to introduce yourself? Oh, you're muted. Dr. James, try one more time. There you go.
Hi, Dr. Rice. Thank you for having me here. And hi, my colleagues. Um, I basically began my career as a public health inspector in my country of origin. So for those who do not know me, I am from St. Lucia in the British West Indies originally, where I developed community health initiatives and addressed public health crises. I worked in public health during the tuberculosis epidemic, and witnessing how a lack of resources left many without care. I worked directly with communities, trained hotel workers to prevent foodborne illnesses, and I also educated students on communicable diseases, dental hygiene, and sexually transmitted infections. These experiences pretty much underline the importance of empowering communities through education and systemic solutions. After I immigrated to the United States, I joined the Nutrition Consortium of New York State during the Reagan administration. Learning from research at the time by the Hunger Action Network that hunger was misdiagnosed as learning disabilities in children, I spearheaded advocacy for the mandated school breakfast program in New York State, collaborating with school superintendents at the time and child welfare advocates. I helped ensure its statewide implementation. This actually remains one of my most impactful policy advocacy efforts, as it provided children with the nutrition they needed to learn and to thrive. I earned my bachelor's degree in sociology and psychology and pursued a master's of science in social work at Columbia University. During my internship while I was at Columbia, I also advocated for a child care center in the White Plains Courthouse in Westchester County, and that was to address the trauma children faced watching their fathers enter courtrooms in shackles. I surveyed stakeholders, developed a proposal, and secured funding with support from the Ronald McDonald House and Westchester County officials. The center remains a vital resource for families navigating the court system. After earning my master's degree, I worked in the New York child welfare system. Uh, I specialized in kin placements and served as an expert witness in foster care cases. After witnessing the systemic challenges that foster care children faced, that inspired me to pursue legal education, earning an honor certification in family and children's services. I'd like to say that my focus of my research is on family and children's services, and that's pretty broad. That includes everyone. However, I tend to look at the current events that are occurring around me in the world, and that's usually the impetus for my areas of research. So you might find in my research that it is quite varied, and I do so as time permits. I represented foster children in Florida's Ninth Judicial Circuit. I advocated for their rights in the juvenile justice system. In 2020, I joined the Center for Economic and Social Justice as a board member and later as a member of its board of counselors. In 2021, I worked with colleagues to advise Missouri Senator Carla May on groundbreaking legislation to combat poverty. Our efforts actually led to the passage of the Citizens Land Development Cooperative Act. That piece of legislation empowers underserved residents with equal ownership in productive land. This innovative law actually creates a sustainable path to economic empowerment and poverty reduction, hopefully with the potential to serve as a national model for systemic change. For the past 21 years, I have taught policy courses, among others, with 8 years at the University of Central Florida and 13 years here at USC. And I've empowered my students to engage in policy advocacy and systemic change. So together, these experiences have actually shaped my understanding of how systemic barriers impact public health and child welfare, and reinforce my belief, of course, in the power of advocacy, the power of collaboration, and innovative solutions to drive meaningful change. Thank you.
Great, thank you, thank you. And last but not least, Dr. Mor Barak.
Hi, and good afternoon, everyone, and thank you, Eric, for inviting me, and Jane and Robert. I'm looking forward to what you have to say. It's delightful to be here. I'll be brief. My name is Michalle Mor Barak, and I'm a professor here at the School of Social Work, and I have a joint appointment with the Marshall School of Business. My research has cut across the two areas, including policies and practices, and has focused on diversity and inclusion. And my book on diversity management has been used widely in schools of business in different places, nationally and internationally, including two measures for inclusion, organizational inclusion, that were the first to be tested via research in different projects around the world. I said to Eric when he invited me that I don't talk politics, I will talk policies. And I hope that that is what we're going to do today. I also bring a global perspective that I think is important to include. And I will say that we're all very fortunate to live in a democracy and have a constitution that protects our human rights. Most people around the world do not have that privilege, and we need to keep that in mind and protect our liberties and the rights of everyone, especially underserved and diverse communities. Thank you.
Thank you, Dr. Mor Barak. Well, maybe I'll just piggyback on what you just said and ask the first question to you, which is, so what are some of the national and global implications for inclusion in organizations and communities that you're seeing that may happen in the next few years?
Well, none of us has a crystal ball. And every administration, when it comes to do the real work, will adjust and change some of its declared policies. What we do know about this administration is that it puts strengthening the economy at the top of the list. And so services to diverse communities probably are not at the top of the list. Having said that, they also have some policies that they're talking about already. If they implement them, they will have profound implications for diverse communities. What they're talking about are tax cuts and limiting immigration and imposing trade tariffs. These are supposed to strengthen the economy. We don't know to what extent they will do that, but some of these actions will affect minority communities and disadvantaged communities. The other thing that they are talking about when they limit immigrations, it will affect the labor force. And so we don't know how that will affect jobs and economic conditions. it might curb inflation, which is what they're hoping to do. It's not clear that it will do it. And I think that what we also see is, and I'll talk about it maybe later if you want, but there are implications for climate change and AI, both of which are topics that I have done some research with and are a focus of my academic work.
Yeah,
I'll stop.
I'd love to get into that those two issues, but maybe I'll circle back in just a second. I would ask some initial questions of some of the other folks. So, kind of following up on some of Michale's discussion about impacting diverse communities. I mean, Dr. Hernandez, I mean, you know, what kinds of potential implications are on your mind, especially with the local communities that you're working with, and the diverse sort of racial and ethnic backgrounds, and you know, even some of the populations who've, you know, recently immigrated to the U.S. I mean, how are you thinking about what you, as Michal mentioned, none of us have a crystal ball, but given the policy changes that have been discussed, what are some of your thoughts? Oh, and you're muted.
There we go.
There you go.
Well, for this country, Dr. Rice, as we all know, the persistence of oppression and a disadvantaged social status have all had a significant negative impact on peoples with diverse racial and ethnic backgrounds. We see this with racial profiling, police brutality against Black and Latinx folks, and the rhetoric, I would say, that we heard during the election and disregard for peoples with diverse racial and ethnic backgrounds is damaging. This can result in high rates of depression, anger, stress, low self-esteem, and cultural shame. This leads me to the work of song that was done on cultural trauma. And we got to keep in mind, Dr. Rice, that cultural trauma is viewed differently from psychological and physical trauma, as it relates more likely to result in a dramatic loss of identity. And when we talk about trauma and when it stems from racial discrimination, it could have a silencing effect. We do know that research indicates that the repeated exposure to racial discrimination that often leads to interpersonal and psychological difficulties may be the strongest reason that community members in marginalized communities remain silent. And that's one of my biggest concerns. We may see an uptick in substance abuse, alcoholism, family and domestic violence. And with COVID, we did see, Dr. Rice, an increase in suicide, specifically amongst our youth. And as tensions build, the stress and strain can produce unhealthy behavioral outcomes. And keeping in mind that for several of our foreign born community members who have endured race related stressors, their history of anti immigration sentiment predated their arrival to this country. So, this cultural trauma can result in immigrant communities specifically remaining silent and hidden amongst adverse challenges. And that's the key. As social workers, we must be conscious and sensitive to this cultural trauma experienced by BIPOC and immigrant populations. Acknowledging this could help us understand the inflicted wound and broker trusting relationships that a lot of the communities will now be very sensitive and conscious of staying away, especially when it comes to reporting certain incidents in the community. So I think right now, more so than ever, we need to think about non-traditional social work spaces to be in. Um, Whether we agree or disagree with this incoming administration, there'll probably be more funding in churches. How do we navigate those spaces, have social workers in these spaces where people still have a place where they may feel a place of safety? Also, what may be well-funded is law enforcement initiatives. I think of the work that doctors Alamo and Ornelas are doing, attempting to increase social work in those areas. And also, we need to be in the courts. We need to be in those spaces where we're able to really highlight the rights of our undocumented communities, because there are rights. We just need to be aware of them. And specifically for our unaccompanied minors, how do we start to navigate the spaces and be able to get in front of certain formal spaces that could actually work against them? So there's a couple other things, we need to consider alternatives to armed responses, and that's much of my work. We look at the use of community intervention workers who have that lived experience, but also this license to operate. We need to start to operationalize some of these formal definitions to help us influence policy, allocate resources and funding. Because if we continue to talk about how do we increase public safety, people may listen, but how do we start to also leverage it with formal systems like social workers, working hand in glove with community interventionists who could reduce the violence, but also increase that access to care and support? And there's certain models. There's the two-prong approach, gang intervention model that I co-authored with interventionists back in 2008. It's formal policy, but now expanding and making it more useful to look at public safety across the board. So these are some of the things and concerns we're looking at. How do we start to increase that trust? How do we start to increase communities that are going to be very tentative to become involved and start to be more hidden? And how do we make sure that they're taken care of and they have the access to care that they deserve and they need?
Thank you for all of that, and it's I too am excited about the possibilities of non-traditional social work spaces. I mean, actually, that's something that all three of you share. None of the three of you are the most well. You all have experiences in very traditional sorts of social work, but you also all are folks that are really actively engaged in non-traditional spaces, and I think maybe along that theme, I want to pick up with Dr. James with one of, I know that you talked about your background with public health and child welfare, and I'm interested in what you're thinking about the implications there, but particularly with your legal background, what you think may, as Dr. Hernandez suggested, that there may be new battles that are going to be in courts, and I'm very curious with your legal background, what your thoughts are about the areas that you've been specializing in for the last, decades.
Well, let me just say that I really think that social work is going to flourish. And I'm really excited, if you will, for the profession, because I think in these times, this is when we should get to put everything, if you will, that we have learned into practice. It's not going to be easy, but I think it can be done. I totally agree with what my colleagues have said. There is little doubt that President Trump's policies, from changes in the healthcare system to restrictions on immigration, even rollbacks on environmental regulations, all of these areas will have significant effects on vulnerable populations, as they have indicated. However, in terms of public health and child welfare, the areas that I have worked extensively in my background, there are potential implications in these areas. And my experience has shown me that public health and child welfare are deeply interconnected. They are interconnected with systemic inequities, often creating ripple effects, if you will, across both areas. In public health, a lack of accessible resources disproportionately impacts marginalized communities. As I saw during the tuberculosis epidemic in my country of origin. Later in New York, when I worked in New York, I observed similar inequities in food insecure communities, where hunger left children unable to focus in class, and that led to misdiagnosis of learning disabilities. So these inequities, I think, they often spill into the child welfare system, where untreated health issues, such as mental health challenges, and as Dr. Rodriguez Hernandez said, I'm sorry, substance abuse use, will put families at greater risk of separation. And if we think about chronic underfunding of early intervention services, that would only worsen this cycle. Research by Nobel laureate Dr. James Heckman, which I'm sure many of you have read or heard about. He's a great economist. It shows that investment in early childhood programs actually yield up to $7 for every $1 spent. And that actually reduces long-term costs in healthcare, in incarceration, as well as welfare dependency. When I think about public health and the way it operates, I see it as often reactive, in the sense that it addresses crises after they occur, rather than investing in preventive measures such as nutrition programs or mental health support. This shifts the burden, if you will, to the child welfare system, and that child welfare system becomes the safety net, if I may say, of last resort. So my work advocating for reforms such as the school breakfast program has actually shown the power of proactive interventions to strengthen families and to prevent crises before they occur.
Well, thank you for that. I was struck by, as you were talking about the list of policy changes that have been brought up. I mean, one of the ones that I think kind of ties back to the point that Dr. Mor Barak, you were making at the very end, and I do want to follow up with this about climate change and the impact that climate change may have on, discussions about rollbacks and the, environmental protections and just kind of what are some of your thoughts about the implications for the environment, and also then perhaps how, I know that you've been starting to think about, as I have for some time now as well, how AI might play into some of those applications for invulnerable communities.
Yeah, first I want to share, okay, here it is. I want to share Dr. James' optimism, because I think that there's a lot for us to do, and share Dr. Hernandez' perspective that we should look at other options for funding and collaboration that are not necessarily central government. And with that, and I'm bringing in my experience with businesses. Businesses are really interested in contributing in many of the areas that we're interested in. And that's not out of necessarily the goodness of their hearts, although I would like to believe so, but it's because of the pressure coming from the public. The public is expecting now businesses to be more ethical, and in order to recruit the best talent, they have to be inclusive, because talent comes in all shapes and forms, and all races, and all social statuses. And so businesses could be some of the collaborators we look at. The other option is, of course, state governments, although that opens another difficult issue, which is, are we going to see differential services provided to people who live in different states? And that's a concern. We've seen that with the abortion issue, and it is a concern that your ability to access services will depend on the place that you live in and your ability to move between states. So now I'll get to the issue of climate change. The new administration is talking about removing regulations in order to encourage economic growth. That's the intention one can say, is a good one, to provide more jobs and to open up more options. The concern is that once you remove regulations, there will be the other thing that they're saying is that they will withdraw from international treaties and environmental climate change agreements. And the concern is that the people who would be affected more than anyone are vulnerable populations in terms of access to clean water, to clean air, just the basics. If we allow different industries to pollute and do not pay attention to what they're doing in the process of making profits, it is a concern. And the people who would be affected the most, I keep telling my students, those who contribute the least to environmental pollution are the ones affected by it the most. And that applies to both communities and countries. The US is one such example. And so I'm really concerned about the impact on vulnerable populations. And I think that there's a lot that we can do with advocacy and with teaming up with some of the biggest philanthropic organizations. Many of the foundations, if you look at their websites, the Rockefeller Foundation and others, the front page is talking about environmental climate change and concern for environmental justice. So we should turn to other potential collaborators that we haven't worked with before. I'll stop here. If you want me to talk about AI, I can wait my turn.
No, go ahead. Feel free. I mean, yeah, I know you've been thinking about the role that AI may have in this space. I mean, you and I have had some interesting discussions about this. I'd love to give you an opportunity to expand on that a little bit.
Yeah, to those who don't know, Dr. Rice and I were part of an international colloquium in France that talked about climate change, population movement as a result of climate change, and potential AI solutions. And part of the discussions were talking about the science that can help us anticipate this population movement. And the population movement is between countries and within countries. And we can anticipate quite a bit of that coming up with the increase in concern for climate change. And we're hoping that AI could help us in this process. And so AI has a potential for helping us solve some of the social problems. The downside is that if you remove regulations, potentially some of those developments will not necessarily be sensitive to community needs and will not have ethical boundaries that are extremely necessary. As it is now, this industry is mushrooming with quick developments that most people, even within the industry, have a hard time to follow. And we don't have many regulations as it is. Removing what we do have would be a concern. Having said that, I think that there's hope that some states, at least, will stop in with some regulations. Also, international regulations, especially the EU, is having some regulations imposed already and are planning to do more of that. And given that the US and many of the businesses within the US are doing trade with the EU, they might need to conform to some of those regulations. And the last thing is communities and the public are demanding accountability. And that's where our role as social workers is most crucial in advocating for, yes, continue the development, but make sure that you have communities and the representatives of society at large in those discussions. I'll stop here.
No, thank you, thank you for that. I think I'm going to. I guess I'll just kind of keep circling around because I've got a couple. I've got a set of questions for each of you, and we've certainly still have plenty of time. But I wanted to go back to you, Dr. Hernandez, and thinking about. Do you see that there are potential implications, especially related to criminal justice and juvenile justice practices? And policies that are on your mind? I know you mentioned in your first remarks that you're concerned about armed police response as something that can happen to in minority communities, and that the trauma that those communities suffer from. But I'm curious if you think that there are other issues related to sort of the justice system that you're on your mind as policies may shift.
Make sure I unmute myself. Thank you. Yes, definitely, specifically here in California. I think sometimes people think California as being that most progressive state. However, we've employed some very heinous, harmful policies historically in California on our youth. We have the largest probation department in the world. That's nothing to hang your hat on. And we've been making a concerted effort recently to really change that game and really make pathways to really support the healthy development of our youth. However, to your question, I am concerned locally. I think some of our flawed policies have influenced other states and jurisdictions. And right now we've been trying to uplift and right the wrongs of the past. But currently with the recent fear tactics, especially how media has portrayed our BIPOC communities, specifically BIPOC youth, it's felt eerily close to what we experienced during the 90s with the whole super predator rhetoric, where we demonized our youth, specifically our youth of color. Keep in mind, Dr. Rice, that during the 90s, we were responsible for so many of those flawed policies, discriminatory policies, such as Three Strikes You're Out, the STEP Act, the Street Terrorism Enforcement Prevention Act, which actually started to labelize groups and youth groups as gang members. So you no longer see a child who's 11, 12 years old acting out their trauma as a child once you label them as a gang member. We also authorized the gang database, gang injunctions, gang enhancements, trying kids as adults under Proposition 21. That was largely done here in California under a Democratic administration at the time. And why I'm bringing this up is because here in California, there was a hyper focus on smash and grabs through the media, which California passed Proposition 36. And let me refer to my notes here. Hold on one second. Proposition 36 increases punishment for some theft and drug crimes in 3 ways. It turns some misdemeanors into felonies. So, for example, currently theft of items worth $950 or less is generally a misdemeanor. Proposition 36 makes this a felony. It can, based on priors. The sentence could be up to 3 years in county jail or state prison. And this was to undo the advancement of Proposition 47 that reauthorized nonviolent offenses to misdemeanors. So again, we're doing away with some of the advances. There could be lengthened sentences for some felony sentences. For example, Proposition 36 allows felony sentences for theft or damage or property to be lengthened for up to 3 years if 3 or more people committed the crime together, and then requires some felonies be served in prison. For example, selling certain drugs. There could be lengthier sentences So again, we saw this, and it's so familiar to the war on drugs. And we know what happened with the war on drugs. There was this mass incarceration, this prison boom. So I'm definitely concerned here on a local level. However, um, going back to my colleagues, there may be an opportunity for social workers to intervene and to be ready to work with the courts to do as much as possible to provide the needed treatment for individuals. This is where we need to start to focus on. We need to be in drug courts. We need to look at drug charges. We need to make sure that we have a thorough understanding to what youth justice looks like. This is happening in real time. It's not theoretical. The current DA mention, and I listen to all different types of people, what they're speaking about, what they're looking at, what they're considering. And I heard the current DA that's coming into office, a willingness to provide treatment. However, there seems to be no second chances if there is a resistance to treatment or no change demonstrated by the individual. This is where we need to maximize that first chance. Regardless, we need to be ready to go. We also need to think about prevention approaches, where I would say most of the funding will probably start to go towards in the current administration. Think of ways we could expand the definition of tertiary prevention, which could equate to early intervention or intervention itself, and being able to demonstrate the effectiveness of harm reduction approaches that can fall under the umbrella of tertiary prevention. And we need to be able to access those dollars accordingly. And then I also can't emphasize enough how social workers need to be in front of any system contact between our youth and families and formal systems like child welfare, juvenile justice, and law enforcement. We know the negative effects once a youth comes in contact with these formal systems. Studies demonstrate and suggest, based on what studies you're looking at, that 60 to 90% of youth who had some sort of form of contact with the child welfare system is in the carceral system. So we know how it's broken up families. And now I would say I was attending City Hall meeting, and some of the data, about 30% of young people are undocumented in LA alone. And about 60% have blended families where there's a undocumented person in that family. So how can we start to keep the families whole? How could we start to stand in front of formal systems that could actually have a adverse effect and negatively affect the families and youth? So we just need to be ready to go and be in all these spaces.
Yeah, I appreciate that. And I want to echo, I think, what I've heard from all three of you, which is this idea that social work and our traditional role as advocates and problem solvers and folks who work with disadvantaged communities, that this is, perhaps as these changes are coming in, it is, not to simply view things as, with as new sets of problems, but as also new opportunities wherein our profession really needs to, is trained to step up in these sorts of situations and can step up in these sorts of situations. And we are the right folks to be, as you put it, Robert, sort of standing between us and some between our clients and some of these systems, in advocating for them. And I guess that maybe brings me to a question for you, Dr. James, which is, thinking about training for social workers, and what are you thinking is going to be needed as we move forward, especially related to policy and advocacy, in the next few years, with, as you said, the optimism that now is the time for us to step up.
Well, I would like to agree with my colleague, Dr. Hernandez, with everything that he said about Proposition 36. First of all, it is so important for us to train social work students to understand these dynamics And he mentioned collaborating with legal systems. The intersection of mandated treatment and the legal system actually necessitates that social workers collaborate very closely with legal professionals so that they can navigate, those complex areas of the law and advocate for client rights. So, as you said, Dr. Rice, advocacy has to take on a new face, if you will. It has to become more robust, and we need to incorporate into our courses more instances where our students can actively engage in action-oriented advocacy. And to go back with the issue that Dr. Hernandez talked about, if we have our students learn how to engage in such robust advocacy, then we can ensure that treatment mandates are implemented justly and effectively. So advocacy for resources, extremely important for social work students. The question might be, how do they do that, right? They need to actively campaign for increased funding. Dr. Mor Barak said, well, I'm not political, but I'm more policy oriented. So I'm talking about social work being political. Social work must be political. Personal things that people experience in their lives are political. They are the foundation for the policies that are being made every day. They are the foundation for the resolutions that are being put in place, hoping that one day these resolutions will become the policies that can provide services to the clients that we serve. So policy engagement is extremely important. Our students must learn to participate in the legislative process so that they can monitor the implementation in Proposition 36, as an example, if you will, thereby advocating for policies that mitigate those potential negative impacts that Dr. Hernandez mentioned on our marginalized populations. What about community education for our students? Our students need to be able to go out there, but first of all, we have to provide them, we have to equip them with the knowledge, the skills, and the ability so that they in turn can inform affected communities about their rights and the implications of the new laws that Dr. Hernandez is talking about, and all the new areas that we're about to be faced with as far as the changes that may come under the Trump administration, thereby empowering our students to navigate the system effectively. What about professional development? I think that's extremely important. I know as faculty, we talk about this a lot. We need professional development. We need to increase space in terms of how well and how effectively we can navigate our profession. But we need to ensure that the pursuit of ongoing training in substance abuse treatment, in mental health services, and legal advocacy to enhance the capacity to serve clients under the new legal framework, we need to be sure that this is occurring in education system. So when I think I'm focusing on Proposition 36 here legally, it presents challenges, but it also presents opportunities. We should always, as social workers, look at challenges vis-a-vis opportunities. So when challenges as all of those that we are discussing today occur, we need to begin to think about what are the opportunities that these challenges present, and how are we going to proactively engage in the advocacy necessary, the education that is necessary, the collaboration that is necessary. Interdisciplinary collaboration is extremely important for social workers. So when we engage in all these areas and when we inculcate these areas in our curricula, then social workers can actually have the tools necessary so they can help ensure that the implementation of these laws promote rehabilitation, if you will, and justice, the foundation of our profession, rather than contributing to further marginalization and systemic inequities. I hope I've answered your question.
Oh, absolutely, and then some. I really appreciate this discussion. I mean, I know that we had in the flyer we had sort of just implicated that we were going to be discussing the policy changes and implications that the national election will bring. But I think it's really important for us to remember that we are as Dr. Hernandez, you pointed out, there are also local and state policies and laws that are really important that are going to impact how we operate. And especially if the federal government is, its role is going to be shrunk, then the state and local may emerge as yet more potent in terms of what is making and the opportunities for people in our communities. And it's interesting to think about, even though, as you've pointed out, we often discuss, California as being this very, sort of, under a Democratic governor was when we had many of these very deleterious policies that came about in the 90s. And I think it's good for us to remember that there's local and state level policies that are going to impact us very strongly in the coming years as well. I think I want to turn, because we have only about 5 minutes left, and I had one last question for you, Dr. Mor Barak, and I wanted to ask this, and then I wanted to turn to the audience. So if you wanted to throw in a question or two into the question and answer session, we will try our best to address your questions. But my last question for you, Michalle, was really stemming a little bit on this last question that Dr. James was answering, which is, are there possible spaces or places where you think that social work might need to anticipate different or additional kinds of engagement, this interdisciplinary or different sort of disciplinary engagement?
Yeah, absolutely. I think we need to open up additional interdisciplinary and global international collaborations. There's a lot that we can do and collaborate with colleagues in other countries and learn from them. There's a lot that we can learn and benefit from that. The other thing that I wanted to talk about, there was a discussion earlier about law enforcement and the legal system. There's another way that we can engage with the legal system, and that is to collaborate with civil rights attorneys who put forward lawsuits, and those lawsuits can change behaviors and actions of organizations and of governments as well. And so we definitely, that's a tool beyond advocacy. Advocacy is very important, and helping to create the laws is very important, but also to find ways to enforce laws that people disregard. And this promise of deregulation of the incoming administration might be or could be challenged in the courts. And so there's a lot to be done there. I do want to mention one last thing, and that we haven't talked about, and that's the implication on research funding. Every administration that comes in has its priorities, and this administration will definitely have different priorities for funding, federal funding for research. I've seen it firsthand in changes between administrations when I had certain projects on diversity and inclusion that one administration was full-heartedly behind, and the other one was about to take it away. And so we should pay attention to that. And if the administration is not necessarily behind our ideas, find other funding opportunities.
Yeah, this last point, I mean, all of these points are great, but this last point that you make is actually what one of the questions from the audience was, which is if we're going to experience a large shift in funding opportunities from traditional grant making in the public sector, especially from the federal government, what are some of the other ways that we might, think about finding funding and also the question is that what are some of the ways to ensure that there's still ethical standards being upheld if we're moving more towards these private partnerships? And I think, I definitely remember when I first got involved in, 20 years ago, 25 years ago, I guess more now, in doing HIV/AIDS research. It was under a much more conservative administration, under the under George W. Bush, and I was doing HIV/AIDS research, and it was very challenging to get some of that work funded because of the political environment. And so I do think that this is something that we will have to look for. And I think, as you point out, Michalle, perhaps it is in looking to private sector partnerships with, corporations who may be, I know certainly companies like Google and Microsoft have, in recent years become grant funding or organizations. I mean, they tend to be in spaces that are more technology focused, but but the foundations, like Robert Wood Johnson or Ford Foundation, these are also places, and I think these are important things for us within the academy to be thinking about, right? I think as we're thinking about, a lot of this conversation has been about the social work profession, but in terms of social work research, which, as the Associate Dean for Research is something that I think a lot about, I do think that it's going to be challenging. I think, some of the grants that have been, enthusiastically funded about diversity and equity, I think those keywords are not going to be things that one is going to, have a lot of success with. There may not even be many funding opportunities that have those foci, moving forward, and it's going to, and how do we as researchers who have long-standing concerns, like, I know you, Michalle, around, well, actually everyone in this room around diversity issues within the context of their research and work, we've all done this work for many years, and how will we be able to continue to do that? I think there's a lot of uncertainty. And I guess with that thought in mind, because I do see that we are at 1 minute to the hour, and wow, time flies. I have been asked that this be just the first of hopefully several, maybe even monthly dialogues around similar issues moving into next semester. So I certainly think that there's a chance for us to have that. It's nice to see that even during finals week, people are showing up in decent numbers to participate in this webinar. And next semester, we will have the social work research seminar, the social justice research seminar, which will be on Tuesdays again during 12 to 12:45 or so. And I know that the audience is all virtual, so if you all kind of, at least in your own space, can give a round of applause to our panelists who were brave enough to accept my invitation to talk about the uncertain times ahead. And I really want to personally thank you all, Dr. Hernandez, Dr. James, and Dr. Mor Barak, for coming and hearing the call that folks in our community were asking for your expertise to share with them your thoughts. And have a wonderful afternoon, and thank you so much.